Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. My guest right now is Rylan Stone, CEO and founder of Medi-Ops. Rylan, thanks for joining me in the studio.
Thank you so much for having me on today.
It has been exciting to watch your progression as you've built this, I'm going to call it a mini empire of medical logistics, tech-enabled medical logistics, helping transport medical. You tell me what you're doing.
Yeah, so primarily we're using technology to enable the transportation of blood product, life sciences, organs, anything that's really, really time critical and has the potential to save lives. We're helping to move that.
I was struggling to come up with the category for organs and blood materials, right? Okay, so that's what you transport. Thanks for saving me there. Tell me about the journey you've been on, because when we first talked, you were just getting started. You started this company when you were relatively young, and now I know you're dealing with air transport, and you're growing quickly. So what's that journey been like?
Yeah, it's been a wild ride for sure. I mean, I started this back when I was an EMT, so working on an ambulance, and just have scaled very rapidly since then. Yeah. Now we're handling many thousands of transports a year between products and patients, really just moving things all around the country. So it's been a wild ride.
What has been the biggest challenge of scaling up the way you have?
I would say the biggest challenge that we've kind of hit is it's a marketplace, so trying to build both ends of it at the same time.
Got it.
So trying to really manage relationships with the operators we work with, as well as the clients that we're servicing, and making sure that relationship is well managed.
Okay, so let's explain to the viewer exactly what the two sides of the product are. Let's just break it down for them.
Yeah, so when a transportation needs to get set up, let's say for an organ, you have that organ needing to get recovered. So usually an organ procurement agency will go out and harvest the organ from a donor, and then they need to move it to a receiving hospital, to the transplant recipient. That needs to get kind of set up and scheduled. Yeah. So our dispatch center or via our online platform will receive that transportation request. Once that transportation request is provided to us, then we can start setting up the operator with the client. So now we can set up that transportation, whether it's ground or air, to that destination, and make sure that we're optimizing for a couple key KPIs, so cost, reliability, speed, to make sure that we can do it efficiently and cost effective.
I'm sort of imagining sort of an Uber-like situation where I'm tracking my product as it goes. What was the system like? I mean, just in terms of like a digital framework, what was the system like before that?
Yeah, so prior to having the visibility into a shipment or a transport, it was phone calls. It was one center calling another center saying, hey, do you know where this vehicle is, this aircraft's at? And a lot of times you might not be able to get a hold of them right away. And when seconds count, that's very pertinent.
Even if it's an organ being transplanted, that it's incredibly, life or death.
Yeah, we always said it was wild that you could track your Amazon shipment, but you can't track an organ.
Crazy. I love the story that you told me about your origins when you were an EMT and you were still in high school. I wonder if you could remind me about sort of the first time that you got your car licensed as a transport vehicle.
Yeah, so being a kid in high school, that was obviously a while ago, but it was interesting going to our state patrol saying, hey, this is what I want to do, and we need red and blue lights and sirens on my vehicle. And they had us explain the entire process, the benefit that we're going to be offering to the community, and they approved it. And we just kind of started from there, and we've grown our fleet, both in-house and our operator network, and it's wild.
And how big is the fleet today?
So I think we have
your capabilities, you might say.
Yeah, so we operate in all 50 states, moving products around. We do have a core.
You said that very quickly, but that's a big deal. You started out in Colorado, but you're now in all 50 states.
So now we can operate in all 50, correct. And we do have some international reach, kind of on an on-demand basis, but more regionally in the U.S.
Very interesting. This is sort of a sidestep, but you started a podcast this year. And so I was curious about that, kind of what your thought process was behind it, but more kind of what you learned putting yourself in the host chair and talking to other health innovators.
Yeah, it was the idea for the podcast was to help kind of break down some walls with our clients and ask our clients to come in and explain their stories and explain the issues that they were having. Very similar to what you're kind of setting me up for here. But the podcast was that platform to have those conversations. And it was really eye-opening to have them talk in a less defensible position with some of our clients.
What did you learn?
I think one of the things that's really interesting is people struggle to see a problem if they're not directly experiencing it. So if we're offering a solution, it is hard to articulate that problem to a client, and having those conversations helped craft our pitches and kind of understand those problems from their perspective.
Okay. Let's talk about what's next in terms of the platform. I understand you've got something called Blood Forward that you're coming out with?
Yeah, so we've been releasing a series of algorithms specific to industries that help the really specific instances, like for a product. So blood, for example, is time sensitive, both for the patient, but then also the product can expire. There's a unique set of parameters for platelets versus red blood cells, when and how they expire versus the urgency. So if a patient is actively in a trauma scenario, that would be considered more urgent. The algorithm Blood Forward that we came out with takes into account all of those factors. So it's looking at patient condition and then helping to optimize and route transportation based on patient condition and then all the other factors that pertain to blood.
Interesting. And then maybe you'll move into other more specific areas of transport?
Yeah, so we're currently working on a whole bunch of other ones.
Got it.
But Blood Forward was kind of the first one that we've launched, and we've had really great success. We have kind of proven that with that algorithm, we can decrease costs by about 30% for transport.
Wow.
It's saving a ton of time.
How does it decrease cost? The time makes sense. How does it decrease cost?
So before that, you were manually looking up flight options. You were manually looking up just routing, trying to look at traffic, and it automates all of that in about half a second.
Wow. Okay. So basically what I assume, like when I came here today, I used Google Maps and it gave me a route here. The things that I take for granted in terms of mapping, you are overlaying onto transport.
Correct.
And all of a sudden it makes sense how it speeds things up. My question is, you upgraded what you could call an antiquated system with phone calls and flight times. This is a time when a lot of aspects of the industry are getting upgraded. Is the competition heating up? Are there more people in the tech-enabled side of this business?
There definitely are. The way that we've been trying to differentiate ourselves is we actually handle the transport end to end.
Okay.
So we're not just the software provider that's kind of coming in.
Yeah.
We are actually able to control the transportation end to end, specifically the ground. So there are employees or are contractors, and we're facilitating that transport, which allows us to, again, control costs.
Very nice.
Yeah.
Okay. And what's next? What are you most excited about for the next maybe 6 to 12 months?
We're onboarding a couple new clients that'll expand our reach and our market share. That'll be really interesting as we do that. Can't disclose too much of it, but we did just ink a deal last week, which is very exciting for us, and we're looking forward to expanding that, and hopefully next year I can give you a little bit more info on that.
What's the greatest challenge? I'm thinking about the personnel side of what you're doing. Some of the companies that we talk to are more tech companies, but you're dealing with transport, employees and individuals around the country. So what are some of the personnel challenges you deal with?
So for us, we had a lot of issues trying to find drivers, but we've pushed pretty hard into kind of repurposing EMS or healthcare personnel and kind of offering them that gig work. If they want to work on the back end, maybe they are a blood bank lab tech, something like that, and say, hey, come drive for us, come work with us, and that's kind of been our driver acquisition pool.
Which is cool, because that's kind of your background. I mean, you were an EMT, so you understand their challenges and what they're looking for.
Yeah.
Rylan, I love what you're doing. I love how you have really exploded over the last few years. You're doing amazing work, and it's going to be exciting to see where you're at next year. It feels like every time we talk, you're at another level.
Yes.
All right. Thanks, Rylan.
Thank you, Logan. Take care.